So today we have a very renowned sexologist, sexual medicine expert, Dr. Amit Mutha from Mumbai. And Dr. Amit, thank you so much for your time. Dr. Amit, I would start with a very basic question. What do you think is sexual dysfunction?
Sexual dysfunction is a broad spectrum entity which includes erection problems, ejaculatory problems, libido problems.
Right?
Okay, so it's a broad entity.
What do you think are the most commonest among these in your so many years of practice? If I may ask, how many years of practice it has been?
It's more than 12 years.
Wow,
I've entered into a 13th year of practice,
great.
and you get quite a few erectile dysfunction cases. Also, premature ejaculation is common. Then you have issues of libido, desire. They are also there, but most common, if you ask me, it would be erection with erectile problems with ejaculatory problems.
And what do you think, sir, is the most common cause of? First of all, I think ask questions that, as per your as per your practice, as per your numbers, how many people in India who are sexually active would have had some sexual dysfunction? If I call, first I would reframe: is it more prominent in males or is it more prominent in females? If I talk about sexual dysfunctions.
So the earlier answers were in the context of male sexual dysfunction.
Right.
Now, if you want to ask me both combined, male and female, there are quite a few women having sexual issues.
Okay.
But Indian context, we cannot provide the absolute numbers because they are not very open. They might be opening up and they will come to us in future.
Right.
But if I see 10 male patients, then there will be 1 or 2 female patients. That is the ratio.
Here. Okay. And if we talk about male patients now, because the more prominence we see in male patients, as you also rightly mentioned, we see at least the major sexual dysfunctions we see are erectile dysfunction.
Erectile problems, ejaculatory problems, and then libido problems.
And are they more
Then the variations of combination of various.
Yeah. Are they more common in?
Sometimes, people who don't have adequate erection, they might also lose the desire to do sex.
Absolutely.
But if they regain the erection ability, they might regain the ability to the desire to do sex. So it is, overlapping.
Very dependent, interdependent on each other. And sir, do we see these concerns or I would say problems in more on urban people or more semi-urban people?
I think you cannot categorize on this basis. The people in urban areas have an access to such specialists.
Yeah.
But I'm sure these patients are also there in the rural areas. In whatever population you are addressing, if there is a diabetes, there has to be erection problems.
Right.
If there is a hyperlipidemia, there will be some sort of sexual problems. If there is a cardiovascular morbidity, there has to be some sort of sexual problems. So this urban-rural divide is blurred. It depends on the accessibility. So such specialists are not yet available at the
rural area.
Primary and secondary levels.
That's true.
These specialists are available at tertiary levels, more so qualified people in India.
And sir, because you've been meeting so many people who have or who are complaining of some or the other sexual problem, how do you think it is affecting their mental health and their overall health?
Come again?
So as you meet so many patients who have some or the other sexual concern or the question or the problem, how do you think, because you meet them in person, how do you think it is affecting their mental health? And how, I'm sure they've been wanting to find the solution, but now they are understanding that who's the right expert who can treat me for a sexual dysfunction. But how is it these problems been affecting their mental health and their overall health?
Uh, to put in perspective, I would say that sexual health is an indicator of overall health.
Okay.
By overall health, I mean mental health, physical health, and psychological health.
Very true.
So, it's very important to have a good sexual life because that indicates if you are mentally unable, then you cannot perform sex. If you are physically unable, then you cannot have a good sexual life. So,
It it affects, and it is actually, can be, you can say, a marker of every segment of your health. If you are having a bad sexual health, you might be having actually a bad mental health.
something is wrong, sure.
Yeah, something is wrong for sure. So then, now coming to the solution actually of these problems, a lot of people in India think that just popping medicines would solve their sexual health problems. Is that true?
In this internet and Google driven age, people search on the Google before then seeking an advice of an expert.
Yeah.
And we have a very casual attitude for medicines. There is easily availability of this schedule X drugs
That's true.
as if they are over the counter drugs, just like popping a paracetamol.
Very true.
So, somewhere the attitude of our in
Society.
our part of the world is quite casual when it comes to
Taking-
medicines.
So, and if not, I mean, I completely agree to that point that medicines is not the only solution, and over the counter medicines at least is never the solution. It has to be taken under supervision. But then, even if taken under supervision, does medicine cure sexual dysfunctions permanently, or can it be
Cure depends on multiple factors.
right?
Okay, if somebody is having diabetes, which is going to be with him for the rest of his life, there is no cure for his sexual dysfunction.
It has to be managed.
It has to be managed. The managed would be, bringing the sugar under control, taking appropriate dietary precautions, and so on and so forth. So, say for example, if somebody is having fear of doing sex,
Yes, anxiety.
so and he has anxiety, he has no confidence. So, if he becomes confident, then he can be without medicine in future. So, to make him confident, we have to do something which will make him sure about his own body and have him believe that he can perform sex.
And how does that confidence can be built? How do you think can this confidence be built
The
up?
multiple things. Counseling is a very important part, and making him realize that his body part is functioning absolutely normal with the help of medications. There are different types of medication which would ensure his good sexual performance. Once he is performing, he becomes confident and his anxiety levels will go down, his fears will be taken care of, and he will become normal. And gradually tapering the medicines as per the
The requirement.
as per the doctor's experience and understanding.
Right. So you think that therapy or counseling plays an important role in treating sexual dysfunctions?
Of course,
Yeah. Yeah.
we have to do something, right?
That is what exactly. So that's a point, Dr. Mutha, that we have been telling people and we have been trying to make them aware of that medicine is very important, but with medicines, sexual dysfunctions cannot be treated until you work on your thoughts, until you work on your mental health, until you work on your anxiety levels, which can only be done with therapy. And I mean, please correct me if I'm wrong. We tell them that it's a journey. It's not पेट का दर्द कि तुमने एक दवाई ले लिया और ठीक हो गया है. Sexual dysfunction is a journey. Please, if you can put.
It all depends on what kind of patient and what is the reason for the sexual dysfunction.
Absolutely.
It cannot be one size fits for all.
Very true.
Yeah. So it's different. If suppose a young patient has an anemia, if his anemia is corrected, his sexual functioning will improve.
That's true.
So it depends on so many other factors.
But if the vitals are right, if the body vitals are right, then what do you think is the right combination for treating sexual dysfunction, whether it's erectile dysfunction or premature ejaculation?
Of course, it's a combination approach where you counsel the patient, you have psychological sessions, therapies, and you have, of course, pharmacotherapy,
Yeah.
drugs. You use drugs depending on the type of patient and how you want to correct it, and what are the expected endpoints.
True. So if we go for this kind of patient, just talking about this kind of patient who have their vitals right, they need.
In my experience, I have successfully treated them 90% of the patients,
Wow.
and they were off medications by the end of 3 to 6 months,
Very nice. Very nice.
which ultimately is the aim that people should perform normal sexual activity without help of any medications in their homely environment or comfortable environment.
So, sir, when you treated these patients in 3 to 6 months, as you mentioned, so these are we're talking about the people who have their body vitals normal or close to normal,
Who are physiologically
right?
and even
Healthy.
psychologically the right frame of mind.
Right. So what is the combination you use on them?
As I said, counseling and drugs, various drugs, which medicines, phosphodiesterase inhibitors, then you have intracavernous injectables. It depends on what kind of patient I am approaching. I will tailor-made the therapeutic aspects as per the need of the patient. If somebody is low on anemia, he is anemic, then I will add iron supplements. If somebody is having vitamin B12 deficiency, then I will give vitamin B12 injections. If somebody is having lack of sleep or irregular sleep or wrong sleep cycle, I would advise them to correct it so that they are more in tune with the natural cycles.
Very true. Just last two questions from my side, sir. One, that do you get patients above 40, 45 years of age?
Of course, my spectrum of age group is right from a 13-year-old teenager to above 60s are quite common, 70s are common. I have few patients, at least 8 to 9 patients who are above 80 years, and the highest age of the patient when he saw me was 87, and now he is 92.
Oh,
So, sex is like having food.
glad to know that.
Age is no bar.
Glad to know that in India also people have that mindset that after a certain age, sex is a no-no, or why are you having?
That mindset is more common than the mindset of or desire to have sex.
Okay, is it? Is
Yeah.
it so?
People think that once you are retired, you're not supposed to
Have sex.
as if one has stopped eating.
Yeah, yeah.
And the biggest myth I want to tell you through your platform, which is prevalent in our society, even highly educated people believe that after menopause, women cease to think about sex or stop to think about having sex. It's an absolute lie,
Lie.
which is fed in our brains. They too are the female counterpart of Homo sapiens. They too have desire and they too want to have sex in spite of whatever age they are in.
Absolutely, absolutely. Very true. So you mentioned that you have. Could you please?
Even women,
You mentioned, sir, that you have patients from the age of 13 up till the age of 70, 80.
13 is for counseling, the newly teenager, they hear stuff,
The
and
puberty part.
and the parents become concerned and they want the right knowledge to be given to the, not a erectile problem, but some.
Right. The puberty part, they're telling that what are the
What are-
changes.
yeah.
Yeah. Okay, got it. Right. I think I would end this session with a note from Sir for people who are fighting with sexual dysfunctions and they're
They're not fighting.
not fighting, but who are probably suffering, I would say. Suffer
Yeah.
is the right word.
So, to all these people, I would like to tell them that most of the sexual problems can be treated, and provided the right diagnosis is arrived at and right treatment approach is adopted, and definitely your problems can be sorted in this modern world.
Great to know that, sir. And thank you so much for your time. It was really a pleasure to talk to you on this platform and to have your so important views on sexual health.